As people age, their nutritional needs change. This guide empowers hospital chefs with practical tools to create meals that support the health and well-being of elderly patients. Chefs can play a vital role in improving their quality of life by focusing on critical nutrients, addressing health challenges, and boosting common needs. Meeting the nutritional needs of elderly patients requires special attention to critical areas that support their health and well-being. Let's explore the essential focus areas hospital chefs should prioritize when planning older adults' meals. Number 1. Protein for muscle maintenance. Protein is vital in combating sarcopenia, the muscle loss that occurs with age. Muscle mass declines about 1% annually after age 50, increasing to 2 and 3% after 60. This decline affects strength and mobility, raising the risk of falls and fractures in older adults. Older adults need more protein than younger individuals to maintain muscle mass. Experts recommend 1 to 1.2 grams of protein per kilogram of body weight daily to help counteract sarcopenia. Protein intake plays a crucial role in mitigating this loss, providing the amino acids necessary to build and repair muscle tissue. Include protein-rich foods like eggs, fish, poultry, and legumes to help elderly patients maintain strength and muscle mass. Number 2. Anti-inflammatory for arthritis. Arthritis refers to joint inflammation and includes conditions like osteoarthritis and rheumatoid arthritis, which commonly affects older adults. The most common form of arthritis is osteoarthritis. It involves the breakdown of cartilage, leading to pain, stiffness, and swelling. The condition is primarily associated with wear and tear over time, exacerbated by factors like joint overuse, injury, or being overweight. Arthritis leads to chronic joint pain and stiffness, which can make it challenging for elderly individuals to complete daily activities. As their joints become less flexible, older adults may have difficulty in mobility, impacting their independence. This reduced mobility can contribute to muscle loss and frailty. Additionally, joint instability, pain, and a limited range of motion can increase the risk of falls, posing a significant health threat for older adults. Chronic pain and mobility limitations from arthritis can contribute to depression and anxiety, as they may feel isolated and unable to engage in activities they once enjoyed. Foods such as berries, leafy greens, and omega-3 rich fish are crucial in managing arthritis symptoms. These foods are rich in antioxidants and anti-inflammatory compounds, which can help reduce oxidative stress and inflammation in the joints. Number 3. Bone health nutrients. Osteoporosis is when bones become weak and brittle, increasing the risk of fractures. It's particularly common in older adults, especially postmenopausal women and those over the age of 60. The leading causes of osteoporosis are insufficient calcium and vitamin D intake, essential for bone strength and maintenance. Approximately 1 in 3 women and 1 in 12 men over 55 will experience osteoporosis, with the risk of fractures being 40% for women and 14% for men over 50. These fractures, particularly in hips and spine, can significantly affect mobility and quality of life. Adequate calcium and vitamin D intake is crucial for managing and slowing osteoporosis progression. Calcium-rich foods include dairy products such as milk, yogurt, and cheese, as well as fortified plant-based options like almond milk, tofu, and leafy greens such as kale and broccoli. Fatty fish like mackerel and salmon, as well as egg yolks and fortified foods are excellent dietary sources. Vitamin D supplementation is often recommended for elderly adults to meet the daily requirement. Engaging in weight-bearing activities is positively associated with bone density. Regular physical activity can help reduce the risk of fractures by stimulating bone remodeling, enhancing bone mass, and reducing bone fragility. Number 4. Oral health and dentition. Dental health significantly determines the type and texture of foods an older person can consume comfortably. As individuals age, they may experience tooth loss, gum disease, or reduced dental strength, creating challenges in chewing and swallowing. These issues can increase the risk of choking. Limited consumption of fresh fruits and vegetables due to dental issues can lead to a lower intake of vitamin and minerals, particularly vitamin C. This can impair immunity and increase susceptibility to infections, especially in vulnerable populations. Chewing difficulties may also reduce the intake of meat and other protein-rich foods, which are essential for muscle maintenance and immune functions in the elderly. Chefs can adopt several strategies to modify food texture to address these dental challenges, ensuring meals are both enjoyable and nutritionally adequate. More tips will be provided later on. Number 5. Cognitive health and dementia. Dementia is a general term that refers to a range of symptoms affecting cognitive functions such as memory, problem solving, language, and behavior. It primarily affects older adults, with the prevalence increasing significantly as people age. Alzheimer's disease is the most common cause of dementia, followed by vascular dementia, which is linked to cardiovascular health. While cognitive decline can start as early as age 40, it becomes more common in individuals over 65, impacting approximately 20% of those over the age of 80. Dementia impairs higher cognitive functions, such as short-term memory, reasoning, and emotional control, leading to the social interaction and independence challenges. As the disease progresses, individuals may experience personality changes, depression, mood swings, and delusional thoughts, increasing isolation and reducing quality of life. Nutrition plays a critical role in supporting cognitive health. Nutrients like antioxidants in berries and leafy greens help reduce oxidative stress, contributing to cognitive decline. Omega-3s found in fish have anti-inflammatory properties and may reduce the risk of dementia. B12, essential for nerve health, is often deficient in older adults and can worsen cognitive decline. It can be found in fish, fortified cereals, and dairy. Additionally, since vascular health impacts cognition, a diet low in sodium and rich in hearty health fats, like those in olive oil and nuts, can help manage hypertension, a risk factor for vascular dementia. When preparing meals for elderly patients, hospital chefs can implement practical cooking tips to enhance nutrition and appeal. Here are some essential strategies to consider. Focusing on food textures that are easy to chew and swallow is essential for patients with dental challenges. Steaming, boiling, and slow cooking vegetables, meats, and legumes makes them tender and more manageable. Turning fruits like apples and vegetables like pumpkin into smooth purees is a great way to make meals easier to consume. Mashed root vegetables such as potatoes are also excellent choices. Protein like ground meat, flaked fish, or casseroles are easier to manage. Additionally, nutrient-packed smoothies made with yogurt, fruits, and vegetables provide an easy and delicious option for those with chewing difficulties. Enhance flavors without adding salt using herbs like basil and rosemary, spices like turmeric and cumin, or ingredients like citrus zest and aromatic vegetables. These add depth and interest to meals without increasing sodium. Protein-rich smoothies or nut butter on whole grain crackers can serve as filling, nutritious snacks. To combat reduced appetite, offer visual appealing, colorful meals and allow choices. Nutrient-dense supplements like protein powders or calorie-dense smoothies can also help meet daily requirements. Creating a balanced menu tailored to the nutritional needs of elderly patients is essential. Here's a sample meal plan that hospital chefs can follow to support their daily health and well-being. Our planned Monday menu is carefully designed to meet the unique dietary needs of elderly residents. Aging often brings a slower metabolism, reduced taste and smell, and health challenges requiring specific dietary adjustments. With 26% of elderly residents diagnosed with diabetes, 22% with gastrointestinal issues, and 10% with renal disease, our menu prioritizes nutrient-dense, low-sodium options. For protein, critical in preventing sarcopenia, immune issues, and cognitive decline, we included high-quality sources like chicken breast, salmon, eggs, and Greek yogurt. For instance, 100 grams of salmon or chicken breast provide up to 62% of the daily value of protein. To support vision, immunity, and bone health, our menu features vitamins A, C, D, and B12. Butternut squash soup is a great example, offering 223% of daily vitamin A and 21% of vitamin C per 100 grams. Salmon provides 66% of vitamin D and 117% of vitamin B12 per 100 grams, supporting bone strength, the nervous system, and the red blood cell production. We also address digestion by including fiber-rich items like roasted vegetables and ratatouille. For instance, butternut squash offers 8% of daily fiber per 100 grams, aiding those with gastrointestinal conditions. This menu not only ensures meals are delicious and visually appealing, but also helps hospital chefs deliver meals that meet the dietary needs of elderly residents, enhancing their overall health and well-being. Now, let's address some common myths about elderly nutrition and share the facts that can help chefs make informed decisions in the kitchen. Myth: elderly people don't need as much protein as young adults. Wrong. Protein is crucial for maintaining muscle mass, preventing frailty, and aiding recovery from illness or surgery. Elderly individuals need higher protein per kilogram of body weight than younger adults to offset age-related muscle loss. Myth: hydration isn't as important for elderly since they don't sweat as much. No, older adults often have a reduced thirst response, making dehydration a significant concern. Hydration is essential for energy, kidney function, and preventing constipation. Myth: all fats are bad for heart health. No, true. While trans fats are harmful, heart-healthy fats from olive oil, nuts, and fish support cardiovascular health and provide essential nutrients. Omega-3 fatty acids, in particular, reduce inflammation and benefit both heart and cognitive health. Myth: it's normal for the elderly to have a poor appetite, so it doesn't need addressing. It's not. Although decreased appetite is common with age, it can lead to malnutrition if left unaddressed. Offering appealing nutrient-dense foods in smaller, more frequent portions helps elderly patients meet their nutritional needs. Myth: supplements can replace a balanced diet. They cannot. While supplements can help correct deficiencies, they can't replace the complex nutrients in whole foods. A well-balanced variety-rich diet is essential, with supplements used only as healthcare providers recommend. If you'd like to explore this topic further, here are some valuable sources that provide more in-depth information. Canada's Food Guide, Seniors Nutrition. A section of Canada's Food Guide explicitly addresses older adults' dietary needs with practical tips and nutritional advice. Academy of Nutrition and Dietetics offers evidence-based resources for healthcare professionals, including guidance on elderly nutrition. Unlock Food, Dietitians of Canada offers evidence-based resources, tools, and guidelines for healthcare professionals, focusing on nutrition for seniors, healthy aging, and chronic disease prevention. To conclude, by understanding the unique nutritional needs of elderly individuals, you can make a profound difference in their health and quality of life. Now, you have the power to craft meals that nourish not just body, but the soul. Each dish you prepare is an opportunity to support their well-being, offering comfort and care through the food you serve. Cooking with compassion is more than a skill. It's a way to enrich lives and bring warmth to those who need it most. If you enjoyed this video, please like and share. Until next time.